Black lung disease kills, and it's once again on the rise, striking minors at much younger ages than ever before. It used to be that we'd see minors dying from black lung disease in their 60s, long before their time. But now we see minors dying from black lung in their 40s. Even people that don't have respiratory symptoms can have black lung. Catching it early can allow you to take steps to keep it from progressing to severe lung disease. The video you're about to see makes it clear that black lung disease affects minors of all ages, and that black lung awareness is a life or death issue, not just for minors, but for their families and communities.
During the 1960s, coal miners demanded protection from the burden of serious health problems and disabling injuries that were the result of mining. Following the tragic explosion at the Farmington No. 9 mine in 1968, the United States Congress passed, and President Richard Nixon signed into law, the Federal Coal Mine Health and Safety Act. That law provided a number of important protections for underground coal miners, including limits on dust exposure and establishment of a medical program called the Coal Workers Health Surveillance Program. The National Institute for Occupational Safety and Health, also known as NIOSH, operates this health monitoring program in research laboratories located in Morgantown, West Virginia. Miners who participate in the program receive health examinations approximately once every 5 years, at no cost to themselves. Chest radiographs can detect the early signs of pneumoconiosis, commonly called black lung disease, in coal workers, often before the miner is aware of any lung problems. After the passage of the Coal Mine Health and Safety Act, the proportion of miners with black lung disease had drastically dropped. However, in 1999, the downward trend of this disease in coal miners stopped, and as stated in the first Faces of Black Lung video, the proportion of disease has more than doubled over the last 15 years. Rates of black lung continue to be on the rise, and as you'll see in this video, Faces of Black Lung 2, the disease is now being seen in very young coal miners.
Hi, my name is Cara Halden. I'm a commander in the Commissioned Corps of the U.S. Public Health Service, and I help to lead NIOSH's Coal Workers Health Surveillance Program. I grew up in a coal mining region. My father mined coal, and many generations of my family were coal miners as well. So I understand that coal mining remains an important part of our nation's economy. However, as we continue to mine coal, we need to diligently protect our miners from the devastating and deadly disease called black lung. Over the past 15 years, rates of black lung have more than doubled. Although this disease is entirely preventable, it's an undeniable fact that many miners are still developing advanced cases of black lung disease. And unfortunately, at NIOSH, we're seeing severe disease in very young miners as well. In the original Faces of Black Lung video, you heard from two coal miners. Both were in their 50s when they were diagnosed with advanced forms of this disease, at a time that should have been the most productive years of their lives. Both of these miners, Chester Pike and Carl Bailey, have since died. Carl was 58 years old, and just 4 months after undergoing a double lung transplant, Chester passed away. Today, both of Chester's grandsons have followed in their grandfather's footsteps and work as coal miners. Dylan is 21 and remembers listening to his pap tell stories about the mines and how much he liked being a coal miner. Dylan wanted to be just like him and started working in the coal mines as soon as he graduated from high school. He shared that his pap was the glue that held their family together. According to Dylan, there's not a day that goes by that he doesn't think about his grandfather and hopes that he can live up to his expectations. Tyler also followed in his father and grandfather's paths and became a coal miner.
I'm Tyler Rosenberger. Chester Pike was my grandfather, my pap. I'm here at the NIOSH mobile unit because it was through NIOSH program that he first found out that he had black lung. He was so proud to appear in the first Faces of Black Lung to give folks some idea of what it was like living with black lung day in and day out. These are pictures of his diseased lungs that were removed during his transplant. You don't have to be a doctor to see the massive disease on his lungs. After his transplant, we all had hope, but he just wasn't strong enough. In the original Faces of Black Lung, he said if he could even help one more miner, it sure would be worth it.
It's not good. And if it can just get out to the younger generation, if we can just help one person, it sure would be worth it.
I know that he's helped numerous miners, but there's still work to do, and losing even one more miner is unacceptable.
Chester was 60 years old when he died. That's far from old age. However, in this video, you'll hear from miners with advanced black lung who haven't yet reached the age of 40. Listen as the miners in this video share their stories with you. Our hope is that they can provide some insight on how black lung disease has changed their lives to help prevent more miners from being affected by this terrible but preventable disease. Please pay attention to the difficulty that these men have breathing, just sitting, sharing their experiences.
My name is Ray Anthony Marley. I worked 25 years in the mines, married, had 3 kids. Probably 18 years I ran a roof boater. In the last 7 years, just a little bit of everything. Rock dusting, hide supplies, just anything that you need to do. I started work right after high school. Basically, it paid the most around here. It's about all they were. So my dad, everybody in my family worked in mines, so that's why I done it. Yeah, probably where I come in contact, with black lung is by working in the face. I worked, basically the whole time in the face, running the roof boater. I lost being able to do a lot of things that I used to be able to do. I used to, play sports, big time hunter, fisherman. But if I have to do anything, I have to wear oxygen. And I never went to the doctors until we shut down. And then when I went to, a couple more physicals, job interviews, they sent me for physicals, and I cannot pass them. Do I have any regrets of working in mines? No. I didn't think I would get sick. My advice, if you're starting out, a young man working in the mines, or even anybody, stay in good air. Always be safe, work safe.
My name is Maxie Brown Jr. I'm currently 39 years old. I live in Ice Camp, Kentucky. That's Sycamore. I'll be 40 December. I have 5 beautiful babies and an excellent wife. I started out coal mining because my dad, I started when he was 16 underground. He owned his own mines. He'd been in it all my life. That's all I'd ever been around, so I know that's what I wanted to be, because he's always provided good for me. But I always liked the environment. I've been around other people, and then the money that he brought in so I could take care of my family. If I could do it, I'd go back today. My actual underground started around January 1st, 98. So I started out underground as ventilation, whatever. After my green card time, I went straight to the roof boater. I'd done that for about 3 years, and then I run the miner for a pretty good while. And I also got my electrical, my bossing. I already had my MET. I got certified in dust, certified limited instructor. I worked with what I thought was double pneumonia until February the 11th. And that's when I went to the hospital and they told me that I need to see a lung specialist. And that's when I found out I had black lung. I went back to the mines, told my superintendent what I've been diagnosed with. He even worked with me and asked me if I wanted to be brought out of the face. So I wanted to continue doing what I was doing, and I kept getting worse. They would give me steroids would work for about a week or two, and then it would come right back. So then I went to see Dr. Brody in Lexington, and that's when he pulled me up completely, March 23rd, 2016. Just for the miners out there that's going underground and doing what I want to be doing, just remember, take care of yourself, because right now I've got 2 9-year-olds that I can't even play basketball with. I got a boy. I moved into college. I had to stop packing his clothes till he's torn. You can't do what you used to. And far as providing, sitting at home, getting the checks that's nowhere half to what you used to bring home, it's rough.
My name is Peggy Nakamichi. I am married and got 1 child. I live in eastern Kentucky, and the reason I become a coal miner is because really it's all they are around here in Kentucky and West Virginia. And my dad and my grandpa and all of them, that's all they ever done. And as a miner, I've done a little bit of everything. I've run a roof loader, I've run a bridge, I've run a scoop. I've done pretty well all of it in a mine. I got sick at work, and I come outside and I come home and I told my wife that I was sick. So after they started diagnosing everything, they thought I had cancer. It come back negative. And then when it finally did come back, it's what I had was black lung. Yeah, and after I found out that I was diagnosed with this, it just really took a toll on me. All the activities I could do outside, I can't do them no more. I'm pretty well on oxygen 24/7 in the house. It's just humid outside that you just can't get out and do anything. I just can't do anything no more.
In addition to sharing their stories, these miners also allowed us to share images of their chest x-rays, which you saw during their interviews. We'll show you those images again. To put them into perspective, this is a chest x-ray of a healthy person, someone without black lung. The bones of the ribs and the spine, as well as the heart and organs and the lower abdomen, are white because they are denser than the air-filled lungs, which appear black. Over time, scar tissue has replaced the air-filled lungs of the miners we heard from today, causing their lungs to appear nearly as dense or as white as the bones and other organs on their x-rays. Dr. Crum describes seeing unprecedented numbers of miners with severe disease in Central Appalachia. NIOSH is observing the same. However, Central Appalachia isn't the only place where we see black lung disease. NIOSH sees cases of black lung in every state where coal is mined.
My name is Dr. James Brandon Crum, and I'm a radiologist here in Eastern Kentucky and Pikeville, Kentucky. And I'm a radiologist, which means that I read the chest x-rays, and a B reader that'll be reading the chest x-rays for any miners or surface operators or anything like that. But I'm a 4th-generation miner. So my great-grandfather, grandfather, father, and then myself all worked in the mines. So being from this area and being a miner, I think we always thought that we would have or get some degree of black lung, probably just like you guys. But the last few years, we've been seeing unprecedented amounts of simple black lung and complicated black lung, which is like we're seeing here on this chest x-ray on the screen. And as you can see here, there's just all the white within both lungs is just large areas of fibrotic masses within both lungs, and that's what we term complicated black lung, which is the worst form of the disease and one of the worst occupational lung diseases that is known to man. And we're seeing significant large amounts of it in particular Central Appalachia. more so than any parts of the country. So I would like for you to be aware of the potential hazards that we have in Central Appalachia. And if you're going to mine, try to mine safely. Make sure that you're doing what you're supposed to do and that the operators and the mines are doing what they're supposed to do to provide you with a safe work environment. The amount of black lung that we're seeing now is unprecedented even before there was dust regulations. So if you work anywhere in the Central Appalachia coal fields such as Virginia, West Virginia, or Eastern Kentucky, pay particular attention to your health and the safety conditions that you'll be mining in. A lot of the complicated disease like we're seeing with this individual is in high-risk areas like continuous miner operators, roof boulders, shuttle cars, or if you're a surface miner, particularly drillers or high wall or thin seam miners, all are increased risk for this disease. So especially those areas, pay particular attention. If you're mining in low coal and taking a lot of either roof rock, bottom rock, or middleman, or if you're cutting out overburden or overcast, those are all significantly increased risks. So try to pay particular attention to that as well. So also one of the big concerns that we have here in Central Appalachia is particularly with our young miners. We're seeing significant increased disease even in individuals which are not very old in nature. So this chest x-ray that we're looking at here that was so bad with these large masses bilaterally of this fibrotic disease, this is actually in a 41-year-old miner. So this is a significant disease in a very, very young miner, and that's one of the concerns that we're having here, and one of the things we hope to help prevent and bring awareness to everybody out there.
If you are a coal miner, you're probably thinking, what is being done to protect me from black lung disease? Under the NIOSH Coal Workers Health Surveillance Program, you have the opportunity to have a chest x-ray, a breathing test, and a symptom assessment about every 5 years at a clinic near your mine. This testing is free to you and is confidential. The results are not shared with your company. Only you receive this information. NIOSH will notify you when you are eligible for this screening. Additionally, NIOSH has a mobile screening program. The mobile unit travels to mining regions around the United States. You'll be notified in advance if the mobile will be in your area, and we encourage you to make an appointment to participate in the health screening process. These programs are confidential and can only protect your health if you participate. It's true that coal mining will always create some dust. However, you only develop black lung disease if you breathe in too much of that dust. Coal operators are required under the law to adhere to federal dust standards. Today's mining industry has the necessary tools to control respirable dust. If effective dust controls are carefully applied and dust levels are accurately monitored, we will be one step closer to eradicating this horrible disease. Black lung can be stopped, but this will only happen when every person who works in the coal mining industry subscribes to the goal of the 1969 Federal Coal Mine Health and Safety Act, which stated that the first priority and concern of all in the coal mining industry must be the health and safety of its most precious resource, the miner. It's not about the rock, it's about you, the miner.
He's had more hard luck than most men could stand. The mines was his first love, but never his friend. He's lived a hard life, and hard he'll die. Black lungs done got him, his time is nigh. Black lung, oh, you're just biding your time. Soon all of this suffering I'll leave behind. But I can't help but wonder what God had in mind to send such a devil to claim this soul of mine. Black lung, oh, you're just biding your time. Soon all this suffering I'll leave behind. But I can't help but wonder what God had in mind to send such a devil to claim this soul of mine.